As you know, that we have seen the challenges here, and we have assembled, as Michael said, three very special people to help us try and break down the information that we have. This pandemic has not only heightened public awareness of the issues, it has also given us an opportunity to address these issues and not only return to the status quo, hopefully, but also to create a more equitable and a more thriving county. As we saw in the report, in order to do that, we have to focus on public health, we have to focus on racial equality and equity, I should say. So public health, racial equity, and we also have to focus on revitalization of our economy. So we're going to explore the vision of recovery, and to do that, as Michael said, we have three very special people with us today. They're Dr. Alan Radner, the CEO of Salinas Valley Medical Clinic and the Chief Medical Officer at Salinas Valley Memorial Healthcare System. Since 1984, he has had a number of leadership positions at Salinas Valley Memorial, at the Natividad Medical Center, Community Hospital of the Monterey Peninsula. Also with us this morning, Andrea Manzo, who is the Regional Equity Director at the East Salinas Building Healthy Communities, a 10-year initiative that has been funded by the California Endowment. And we also have with us this morning, Kate Roberts, President and CEO of the Monterey Bay Economic Partnership. That's a member-supported nonprofit organization that's working to improve the economic health and the quality of life in the Monterey Bay region. Even during the best of times, we know that collaboration is so important to tackle these sort of complex problems. And over the past 6 months, all of us have been focused on health and the unusual steps that we've had to take in response to the pandemic. And so to begin, we have asked Dr. Radner to share with us some of really the extraordinary work that has happened across our health systems and with other sectors as part of the response in Monterey County. Dr. Radner.
Thanks, Dan. Can someone bring up my slides? Not sure if you can see those. I think Spencer's supposed to bring them up. Great, thank you. So when Katie asked me to give this presentation or to participate this morning, I did a quick survey of all the work that's been done in Monterey County with respect to collaboration between the institutions and with our community partners, and I was a bit overwhelmed. There's an awful lot. So I'm going to barely be able to scratch the surface, but I'm going to very quickly talk about some of the things that have been done, again, between partners and between institutions. There's really been pretty unprecedented. Again, why we've been doing this and what we've been doing. So can I get the next slide, please? So I just want to remind everyone that in Monterey County, there's essentially 4 hospitals / healthcare systems, and we're very fortunate in that they're all essentially community owned, whether they're public district hospitals or public safety net hospitals. We all are essentially beholden to our communities. And if you actually look at the mission and vision statements of all the institutions, they're remarkable. They're remarkably similar. We all are committed to taking care of patients who are ill and also to be proactive with respect to our community's health. Can I have the next slide, please? So this is a slide that Adrienne Laurent, our Chief Strategic Communications Officer, forwarded to me, just showing at Memorial Hospital or Salinas Valley Memorial Healthcare System, all of the partnerships that we have with the community, both with other healthcare systems and with other partners. All of the institutions have similar slides. We've all been completely involved in what's going on in our community. Can I have the next slide, please? There's also been a number of projects that, again, we don't have time to talk about, but these are huge, very complicated, resource-intense, multi-year projects that many people in the community have worked on that, again, is pretty unique for what's happening in our county. Can I have the next slide? So I'm not going to spend a whole lot of time talking about what everyone knows, the totality of the worldwide pandemic, but it's important to point out, I mean, Monterey County certainly hasn't been spared. There's an extra 0 there under the number of cases in Monterey County, but the reality is we've had about 10,000 cases, probably closer to 600 hospitalizations and 70 deaths. So this has had an enormous impact on what we do on a daily basis in the hospital. This weekend I was on call. I put 2 20-year-olds on ventilators with COVID. This is still a huge issue in our county. Can I have the next slide, please? Michael spoke to this. I mean, there's become an increased reality that there are certain groups that we know do worse with COVID, people with comorbidities or the elderly, but there's also increasing awareness that socioeconomic vulnerability will not only increase your risk of developing an infection, but your likelihood of dying. And this is a recent paper from McKinsey and Company. Again, as Michael pointed out, in Monterey County, this has disproportionately affected the Hispanic and Latino communities. And we've seen that throughout the country that people of color are disproportionately not only infected, but have an increased likelihood of dying. Can I have the next slide, please? So given that background, let's talk about what we did as a community. So we had our first 2 cases in March, and I think everyone was looking to the health department to try to kind of lead us and direct us as we went forward, particularly the Public Health Bureau. I also work for the Public Health Bureau. I'm the Monterey County TV controller, and I can tell you that like all counties and all public health departments, they were profoundly underfunded and had limited bandwidth, and they were expected to kind of lead the charge in so many areas with respect to this pandemic. Can I have the next slide, please? The healthcare systems were also immediately challenged. We had to take care of patients with COVID and non-COVID related illnesses, and then there was a long list of initiatives or requirements and needs in our community that affected both the healthcare systems and the global community. Next slide. So our vision was that we would all work together, which again is pretty unusual for most communities, and we would all try to support the Monterey County Health Department. Next slide. I'm going to talk principally about work that came out of 2 working groups. We rapidly put together what we call the Monterey County Health Department COVID-19 Planning Committee, which SVMH hosted, but all of the institutions, including the health department, all of the hospitals worked together. And this was really kind of an operational group dealing with a long list of issues that are listed here. We've been meeting weekly since March, and it's been incredibly productive. Additionally, we put together kind of an executive working group called the COVID-19 Collaborative Working Group that we brought Lou Bauman out to help, and he's led this with Charles McGee, and they've really looked at kind of policy, direction, resource support, how we're going to fund things. And what I'm going to focus on now is some things that came out of those groups. There were 4 major areas that I'm going to talk about very quickly to illustrate what we did collaboratively. Next slide, please. A lot of work with respect to kind of emergent needs clinically. What ended up happening is a lot of the initial services and resources were allocated from the federal government to the state to the county, and these working groups kind of sat together and tried to distribute things like personal protective equipment and medications in a fair and equitable manner. And it's really been remarkable how the healthcare systems have worked together. We're sharing everything, sharing things with our community, and it's been really pretty remarkable what's gone on over the last few months. Additionally, we realized that the extended care facilities and nursing homes had enormous challenges. At Memorial Hospital, we were notified of the first patient in a nursing home who was infected with COVID-19, and within an hour, I went out with 5 other people on our team, and we helped them with resources and education and policy and communication and all the things they needed to do. There was ultimately, Natividad helped us on the Salinas side, and CHOMP put together a very similar policy that's helping the extended care facilities in Monterey. Additionally, we've tried to work collectively on policies to educate providers, and I just showed this is a memo that went out having to do with testing, and you can see that all of this education is now coming out that's co-branded by all of the hospitals. Can I have the next slide, please? Testing is a 2-hour discussion on its own, and I'm not going to go into all of it. I just would say that when we realized, and this came out of that collaborative working group that Lou Bauman led, that there were certain areas that didn't have adequate testing availability. So what we put together was an initiative with all of the hospitals funding it. We brought in VNA and we set up so-called pop-up community testing sites, and you can see on this, this is a schedule that all of the hospitals took turns staffing it, as well as VNA. And this was a pretty remarkable initiative to try to meet the needs in our community. Next slide, please. We realized very early on that one of our biggest challenges had to do with the reality in Monterey County that we had a number of people living in communal or conjugate living situations. We would have patients come to our emergency rooms that were often seasonal essential agricultural workers and they had COVID, they may or may not needed to be hospitalized, but if they were being sent out, they were going to places where often there were 10 or 15 people living in a very small area. So we really wanted to kind of decompress that. And there were two emergency kind of alternative housing site initiatives launched. One was led by the Monterey County Emergency Operating Center, and the other was one that was supported by agriculture. And I'll show a very quick slide talking about that, but the idea was that we would identify these people and place them into a safe housing situation, decompress the area they were living, and the county could do contact tracing in that location. Literally hundreds of people were placed into these alternative housing sites, which I feel pretty strongly dramatically decreased the number of cases that we ultimately saw. Next slide, please. I'm not going to go over this because of time, but this was one of the collaboratives that Memorial worked on with Growers Shippers Association. But again, there were multiple collaboratives that independently the healthcare systems worked on with various community members. Next slide. A lot of work in community education. I gave a number of talks, people from the health department gave talks, other infectious disease doctors gave talks to try to educate our community. Many of us are working on planning groups and reopening schools. I'm on 3 or 4. Other people are in institution. I know people at Montage and Chomp that are working to support schools as well. So we're all really trying to help schools and educate them and how they can reopen. And the last couple of comments I want to make have to do with agricultural worker and a community education campaign. We can go to the next slide. As we've already talked about, the essential agricultural workers were disproportionately affected in our community, and we really felt we needed to get out there to try to help. We put together kind of a prevention best practices program where we had nurses go out to the fields and educate people on how to avoid COVID. There was a project directed by SBMH where we reached 12,000 people over 12 different companies, both in the fields and the packing facilities. And again, I know the other institutions had similar programs. Next slide. And this is pretty much the conclusion. So there was also a call that there was some concern that, or a belief that there'd be benefit in having the healthcare providers also send an independent message from the Monterey County Health Department to try to increase awareness and slow spread. So an initiative was raised, and I think many of you may have seen there was a July 29th event, which we're kind of calling the Hospital Leaders Speak with One Voice, where this is an image from this media event where all of the CEOs of the facilities in Monterey County spoke to the needs going forward. There was also the initiation of a media campaign, Mask Up Monterey, which I'm going to show. The last slide is just a picture from that showing our attempts to educate people on the severity of this, the reality of this, and what we can do to try to mitigate the spread in our community. This was funded both through the hospitals and through public service announcements. So the last slide is just one of those images, and I'm just going to conclude by saying, you know, it's really remarkable. Most communities, I have friends in communities, even in the South Bay, where the hospitals compete and fight. They never work together in this, and it's really pretty remarkable that in our community that all of our healthcare systems with similar missions have gotten together and have really tried to support what needs to be done, again, with each other and with our community partners. So let me stop, and I thank everybody, and again, thank you, Katie, for inviting me.
Dr. Radner, thank you very, very much. Another key priority that we want to focus on today is racial equity. And so that includes topics like creating and maintaining spaces to talk about racism, addressing inequitable systems, and also overcoming systemic barriers that face some of the most vulnerable in our community. And so Andrea now is going to talk about some of the work that's underway to address the critical needs there.
Good morning, and thank you for the invitation. As mentioned, I'm with Building Healthy Communities, that is under the umbrella of the Action Council. And for those of you that don't know, I'd like to take a quick moment to share a little bit about who we are. Our mission is to build a resident voice and power for a healthy and inclusive democracy that's grounded in a healing informed racial equity framework, which means we support resident leadership to change policy and systems. And as we've heard today, and we all know, race is the #1 indicator of outcomes. It determines how well you fare in life. And as seen in the IMC report, it has impact on educational achievement, safety, health, and economic self-sufficiency. The IMC report is a documentation of the racial inequities that exist in our community. And for this reason, BHC has been focusing on normalizing conversations around race and finding ways to advance racial equity within systems. And when I refer to racial equity, it's a strategy for eliminating racial inequities in systems, structures, and outcomes by prioritizing those most adversely impacted by structural racism, thus improving the outcomes for all. Next slide, please. In 2018, BHC launched toward a racially equitable Monterey County, an ecosystem approach to racial equity comprised of stakeholders in government, community organizing, and philanthropy to achieve outcomes for all people in Monterey County. TREMC is a strategy to build resident voice and power by building capacity across the multiple sectors. Those involved get clear on their unique roles and how to play those roles in healthy relationship to the other sectors involved. This approach is also rooted in a healing informed practice, which means it involves relationship building, conocimiento, and trust building. I'd like to share an example of how United Way as a funder has played a role in a healthy relationship with residents. As one of the funders for the new Alice L. Union School District Early Childhood Education Center, United Way, specifically Katie, took a step back to understand the needs of parents to center their voice in moving the project forward. She supported the request of parents to include an expectation of community engagement practices in the development and the operational planning of the project. Katie used her power as a funder to support organizing efforts and knew that the success of the project depended on the level of engagement of residents. And funding can sometimes be harmful if there is no clear reflection on unintended consequences. And this was an opportunity to shift power and support the voices of residents as part of this process. This is an example of working at a systems change level that moves away from a charity or a paternalistic model of economic support to the community. And when the pandemic hit, like United Way, it shifted our priorities on focusing around building resident leadership to also connect residents to resources. BHC organizers and leaders conducted one-on-one calls to see how residents were doing and connected them to resources that the United Way quickly compiled for community leaders to use. BHC also needed to be responsive in light of the national movement for Black lives. And although we had planned to launch a racial equity cohort, a year-long racial equity cohort series in the next year, there was a sudden opportunity and desire to engage in conversations about race, and therefore launched a racial equity learning series last month. These monthly sessions have attracted over 160 folks across sectors, including residents, to engage in conversations regarding racial inequities and unpack the contributing factors. The Racial Equity Learning Series is meant to lay the foundation of learning that will be support more coordinated efforts for racial equity in Monterey County. We have folks participating from county government, city government, school districts, and community-based organizations and residents across the county. And part of the tools that we're sharing in the series and that has been used in previous planning processes, such as the City of Salinas Alisal Vibrancy Plan, is the spectrum of community engagement to ownership. It's a spectrum that shows the different levels of engaging the community in decision-making processes, and it is a tool for systems to use to assess and plan community engagement efforts. It moves from ignoring and marginalizing the community to collaboration and community ownership. It is about throwing out the status quo to doing things quickly with a top-down model, and instead involving residents in building the types of robust, sustainable solutions that are needed. Padres Unidos and La Cosecha, two groups within BHC of organized residents, are currently working on racial equity issues related to distance learning. Next slide, please. Racial equity is about power and learning to shift the power to those most impacted, and knowing that racism has been functioning as intended for hundreds of years. So it is going to take some time to undo the impact of those policies and practices. That's why it's important to focus on racial equity, and knowing that not just one system focusing on it is enough. In order to address the structural racism, we all need to be committed to dismantling it. It is deeply entrenched in our systems, in our ideologies, so it requires intentional work. We need to focus on the way the various institutions interact and the unintended consequences they create collectively. And as we think about the current issues in our community as we are facing this pandemic, it is making it impossible to ignore the relationship between race and health, race and housing, race and education, race and income, you name it. Those most impacted by COVID, not only in terms of cases, but economic impacts have been people of color. And if we can acknowledge this truth, the truth that Black people especially have been historically negatively impacted due to structural racism, we have a really great starting point. It will not be easy because it will require us to be comfortable with being uncomfortable, and it will require that shift in power. However, when people of color most disproportionately impacted thrive, we all thrive. And that is why it's important to center race as we build solutions moving forward. Thank you, Dan.
Andrea, thank you. The final area that we have to share when it comes to the vision of recovery is revitalizing our local economy. So this can include investing in workforce development to train workers while expanding pathways to higher wages and focusing on asset development within families. Instead of going back to the way it was, the big question is, how can we develop an inclusive economy with more opportunity for all and not just for some? This morning, Kate Roberts is here to provide some insights for us. Kate.
Thank you, Dan, and good morning, everyone. As many of you know, the majority of the Monterey Bay Economic Partnership's work focuses on specific initiative areas that are the underpinning for a thriving economy: affordable housing, a strong workforce pipeline, ubiquitous broadband access, and climate change mitigation, which includes transportation improvements. But I wanted to spend my brief time today building on what Andrea talked about and reflecting on the importance of racial equity as it relates to our local economic recovery. What kind of inclusive regional initiative would best advance ongoing efforts to make our economy work for everyone? Well, in partnership with California Forward and local community-based organizations, including the United Way and my fellow panelists, Building Healthy Communities and Salinas Valley Memorial Hospital, MBEP is leading a regional economic development initiative called Regions Rise Together Salinas that emphasizes inclusivity and prosperity for all residents of the Salinas Valley. We are starting with race and the root causes of racial inequality. Unpacking structural racism is necessary as a precondition for starting this initiative. For instance, as Andrea mentioned, where things get built, where we invest our money, and how our schools are funded. What if we changed our investment paradigm and created a new capital pool available to enable local recovery and resiliency that took equity into account? You've heard this idea perhaps referenced as investing in Main Street versus Wall Street. What would that look like? And how could we build on the good work already happening in this area? One outcome of this process will be to synchronize existing efforts to advance collective action around one common initiative. The United Way's Impact Monterey, the Alisal Vibrancy Plan, Monterey County's Comprehensive Economic Development Strategy, or CEDS, the Community Foundation of Monterey's Impact Investing. These are just a few examples of the many levers that Monterey County is currently engaged in that are being incorporated into this effort. Another key outcome will be the creation of a blueprint that will be an investment roadmap and a rallying cry to attract investment to our region by sending a loud and clear message that we are investment worthy and investment ready. These are just a few ways we can all work together to revitalize our local economy. I look forward to working with you all in this exciting new endeavor. Thanks, Dan. Back to you.
Sorry, I'm still not very good at this. Thank you. So the question then becomes, how do we move forward? During the panel, we touched on a lot of things here. And we want to ask all of the panelists to come on the Zoom stage, if you will, and talk about a key final question. And I'd like each of them to answer, where do we collaborate? How can we collaborate to address these areas? We're going to start with Andrea.
I think I'll start by saying that it's necessary. We heard, that the hospitals work together and was essential during this time. And so in order to meet the scale of the issues, we need to collaborate, and we need to continue seeing the intersection of these issues in all of our work. I would invite folks to see the power of collaboration not only across the different sectors in terms of systems, but also to think about those most impacted by the decisions of the systems as part of that collaboration. It's an opportunity to just deconstruct the way that racial structural racism has manifested in our communities. Each of these different sectors has played a role in perpetuating the inequities, and in order to have successful collaboration, it's important to acknowledge that harm that was done and move forward to address the root causes. We need to be able to see that our fates are intertwined, and that residents experiencing those inequities day in and day out really don't care who's in charge of what area or not. They want the issues to be addressed, and this is where the opportunity lies to create a shared vision for racial justice. Padres Unidos, the parent community I talked about earlier under WHC, is working to shift culture, policies, and practices within system, and has a vision to build an interconnected systems that support children and residents throughout the community. And this vision is only achievable if there's an intentional and conscious step forward to move beyond silos and acknowledge the intersection of the issues. And so, taking the current national issue around digital divide, it has heightened visibility because of the lack of access to students, but it really includes more than one institution. And so in order to think about health and the inclusive economy, we need to do that with a racial equity lens moving forward, with a shared understanding of the historical context that's contributed to our lack of health and economic mobility and viability. And we need to center residents as part of the process and have enough humility that we do not know all the answers, and there are many experts in the community with lived experiences that can guide us toward a collective vision and the necessary solutions.
Andrea, thank you. Kate?
Well, what we're experiencing is a trifecta of crises, right? And you throw these massively destructive wildfires that we've had recently in the mix, and you have concurrent challenges that this county has never seen before, all at once. And, I just have to say that what Andrea is talking about and what I was talking about earlier, this idea of racial equity needs to be the foundational element going forward as we rebuild our economy. That has to drive our efforts if we're going to really come out as a changed economy and a more improved economy. Because if we truly commit to changing race-based structural mechanisms, then we will see improvements in access to healthcare, in more equitable infection rates. We heard from Dr. Radner. Because we know we're going to have more pandemics, right? This COVID-19 was, I think, probably the first of other tragedies that we're going to see in the health world. So we need to really think about how we're going to prepare our residents in our region to be more resilient in this way, and also more resilient in an environmental way when we think about the fires. And we just need to think more holistically about creating good paying job opportunities that really lift all of our residents out of the poor economic conditions that plague so many of us.
Kate, thank you. Dr. Radner, collaboration.
Well, I guess I'll, again, take kind of a medical perspective here, that I'm a believer that we're not going to recover economically or as a community until we get control of this pandemic. And I think, unfortunately, there's still a long way to go. I think, again, I'm an advocate of trying to open up society as much as we're able to, but I'm concerned that we're all keyed into what we did in May, where the idea is that this is kind of past, we're going to open up society, we're going to go forward, and this is gone. And the reality is, I think we still have a long way to go fighting this pandemic. And all of these issues that have been raised by the other speakers, and we've already talked about, I think are still going to be critically important over the next 3 to 6 months. I think we still need to provide for a community, work together, recognize all of these disparities, and really try to control the pandemic as best we can with respect to a deliberate, intentional opening of our community, continue to mask and physical distance, and all the things that we still need to do. And I'm hopeful that, I'm certain that we're going to get over this. But I think, again, without getting this pandemic under control, without getting COVID-19 under control, I think it's going to be just a perpetual challenge, and we're going to see these stops and starts that they've seen all over the world. So I just think the work that's being done really needs to continue, and we can't get tired and give up on this. It's just critically important over the next few months.
Dr. Radner, thank you. Very quickly, next steps, Kate? Kate, you're muted.
I'm
There we
muted. So sorry. Yeah, rookie mistake. Okay. So I think, talking about next steps as far as United Way and this idea of staying the course, I just think that is really they hit the nail on the head with this. The role that United Way plays in ensuring the basic needs are met for our residents can't be understated. Through their partnerships and their programs, thousands of our neighbors have food on their table, a roof over their heads, and a leg up at school. Is there more work to do? Of course there is. But I mean, I'll say something a little provocative, but I think our goal really should be to put the United Way out of business, right? And let's hold that vision for a second, that everyone in our county has a safe and healthy home, enough food to feed their family, a job that pays well and makes them feel proud, an education system where every child succeeds and prepares them for a job they love. And I just want to take a moment to really commend Katie and her leadership. She has not only kept United Way on course, but she has brought new ideas and cultivated unique partnerships that are creatively addressing the social determinants of health and challenges our residents face. So thank you, Katie, and the entire United Way team. We look forward to continuing our collaboration and working closely with you.
Kate, thank you. Dr. Radner, next steps.
Again, I really have nothing to add to that. I mean, again, I think this concept of collaboration is absolutely critical. I'd also like to thank United Way, and I think we just need to continue to do this as we go forward. And again, very appreciative to everyone who's here and helping and working together.
Thank you. Andrea?
Just adding to what Kate said in terms of, the power that, United Way has in the community, really being able to be a force of leadership around, changing the narrative of what it actually takes to support our communities. And so continuing on that course to doing their own internal work around racial equity and being a leader in that work to moving this forward and closing those racial equity gaps.
And we all know how hard it is to stay the course.